I have my gloves set up and my tray for venipuncture. I've already washed my hands with aseptic technique. You want to make sure you put on your new pair of gloves and put your supplies together on your tray in front of your patient so that they know you're using clean, unused supplies every single time. On my tray, I have a 21 gauge butterfly. This setup goes paired with a hub without a safety on it. And I have another hub without a safety and a needle. This needle has a safety already attached to it. For each setup, I have 1 alcohol prep and 3 gauze pads. So since I'm performing 2 draws on my patient, I have a setup for each. And I'm gonna go ahead and unpackage my butterfly. Gonna undo the plastic covering that's covered over the needle, and I'm gonna twist this into my hub, making sure it's securely fastened and on there properly. I'm gonna put that to the side. I'm gonna do the same thing for this needle setup. I'm gonna twist the seal, pull off, and the gray ended portion is gonna go twisted into this hub, and just make sure it's secure on there. Now I'm ready to go ahead and tie off the tourniquet on my patient. Now remember, we're gonna draw in the antecubital space, so we're gonna go about 2 or 3 inches above the space, which is right here on the opposite side of the bend of her elbow. I'm gonna stretch the tourniquet, place it on my patient, make sure it's nice and tight. I'm gonna ask my patient to squeeze and hold on their stress ball. I'm gonna begin to palpate the area. Again, please make sure you palpate with your fingers, never your thumb. Your thumb has a pulse in it and can be confused. I've located my vein here, and I'm also going to palpate the direction because I need to know that information so I can insert the needle properly. This vein is going just slightly up towards the right side. So once I've located my vein, I'm gonna go ahead and clean with aseptic technique using my alcohol prep 3 times around. I'm gonna wipe dry with 1 gauze. I'm gonna grab my butterfly, and I'm gonna grab with ridges downward on the wings and pull a wing over. So my hands are only placed onto the wing portion. Then I'm gonna twist and pull the plastic sheath off of the butterfly. I'm gonna hold my butterfly only by the wings, and I'm gonna insert the needle bevel up. I'll pull the skin, making sure I've planted the vein in place. I'm gonna go ahead and insert my needle and wait for that flash of blood to appear in the chamber. Once that's occurred, I'm gonna go ahead and take my tube using my flange, which are those plastic ends coming out on the end. I'm gonna go ahead and push, and then push my tube right back off once I see blood into my tube. Next step is to pull my tourniquet. I'm gonna grab 1 more piece of gauze, hover over, and I'm gonna withdraw my needle completely and begin to apply pressure. Once I'm out, I'm gonna have my patient hold pressure there. I'm gonna grab by the wings only still, and I'm gonna touch this yellow portion, the little box portion on the end. Okay, this portion here, and I'm gonna hold it secure with my other hand. Now I'm going to let go of the wings and put it onto the tubing, and I'm gonna push this yellow mechanism up all the way so it completely covers my needle. The safety has been applied correctly once I've done that. Go ahead and toss this in the sharps container. And then I'm going to replace that used gauze. I'm gonna fold it into quarters. Okay, so a tiny little square, and I'm gonna replace this one. I'll have my patient put on the dirty side of my tray. She's still gonna hold pressure, and then I'm gonna seal off her wound with Coban. I'm gonna adhere this Coban to the end. We're still gonna hold pressure, and I'm gonna wrap this wrap around while it's stretched, okay, while it's tight, actually applying pressure. Only wrap it around 1.5 times. Stretch the Coban and rip, and then it kind of is a self-adhesive, so it sticks to itself, okay? Then the next draw I'm going to perform is the vacutainer draw on my patient's opposite arm. Again, I'll apply the same steps here. Okay. I'm gonna go ahead and tie my tourniquet off, make sure it's nice and tight on your patient. Okay. And she's going to squeeze on her stress ball. And again, I'm going to drag my fingers across the antecubital space to locate her vein. I feel a good one right here. Again, palpate for the direction. I'm going to clean with alcohol using aseptic technique. I'm going to clean around 3 times. And then I'm going to wipe dry with an unused gauze. I'll pull the safety down to get it out of my way so I can see. I'm going to uncap my needle, and again, going bevel up, I'll pull the skin, secure my vein, plant it, and I'm going to insert my needle, plant my hand here, grab my tube, and again, using my flange, push my tube onto the hub. And there's my blood. I'm just going to push the tube right back off. I'm going to pull the tourniquet. Again, using my second piece of gauze, I'm going to hover over my patient, withdraw the needle completely, and begin to apply pressure. And then I'm going to hit the safety immediately. Put that in the sharps container. And then I'm going to fold up my third piece of gauze here into quarters, just like I did her other arm. We'll replace this dirty gauze, and she's going to hold pressure again. And with the Coban, I'm going to go around again 1.5 times around her puncture site, making sure we apply enough pressure and stop the bleeding. Stretch your Coban again and rip, and then it's self-adhesive. We're going to go ahead, once our instructors have given us credit for these tubes in the drawer, we can toss them in the sharps container as well. And then I'll bundle all of my dirty supply, everything that belongs in medical solid waste. I'm going to bundle up in the towel and remove my gloves appropriately.